So I'm originally from New Zealand. I was born there and grew up there and went to medical school and started my clinical career at Auckland City Hospital. I always had an interest in research and using strong data and evidence to inform what we do with both our clinical work and also how we think about health systems. And so after having spent some time in New Zealand working clinically, I moved to the United Kingdom to pursue a PhD at the University of Cambridge. There has been a lot of interest in global surgery in the last 5 years in particular, I'd say. But initially, back in sort of 2011, 2012, when I was living in the United Kingdom, there was a small but dedicated group of surgeons who'd spent a long part of their career working in international health. And they spoke to several editors at The Lancet and said, this is a very neglected area within international health that deserves to be showcased and spotlighted in an international medical forum. And at that time, The Lancet was producing commissions where they were bringing together people from diverse backgrounds to try and address under-researched areas in more than a sort of 3,000 word article. And so at a conference in the UK in 2012, I think it was, the Lancet approached a group of British surgeons and asked if they would be interested in forming an international commission to try and document global surgical need, and particularly surgical need in low and middle income countries. The commission brought together collaborators and partners from 110 different countries around the world over a 2-year period, which involved a lot of Skype conference calls at strange hours as we brought everyone together across different time zones. And it certainly reinforced to me that we live in a small world, really, after all. One of my biggest passions is how we can use data to better inform healthcare planning and healthcare service delivery. And so I'm very interested in understanding how we can develop surveillance methods in all of the countries in the world, not just in high-income countries, to better inform and react in real time as to where there is a need for different health services, including surgical care. I think that there is a great need for training of surgeons in low and middle income countries, and certainly in the same way that we partner with other surgeons in high income countries to learn new approaches and new techniques, there is a role for training and education. I think for me, sustainability in terms of global surgery means the ability for patients, clinicians and countries to determine what they want and what they need, and to be able to prioritise and make choices about them in a way that doesn't reflect significant limitation on resources, but is more around need and priority. Students and residents, I think, around the world have driven a lot of the university's interests in global health and also in global surgery. And I think there is a recognition in 2017 that as a result of technology and the ability to be a lot more interconnected, there is an understanding of our interdependence and also the scale of inequity globally. So I strongly believe that global doesn't mean countries outside of where we live, but that it means all of the countries and places around the world. And in fact, when we first defined what we thought global surgery meant in The Lancet back in 2014, we specifically emphasised that global surgery is about processes of surgical care that affect all of us globally, and about addressing inequity and disparities that is irrespective of geography. So I very, very strongly believe that global surgery is about understanding and addressing inequity within surgical care and surgical outcomes in all communities, whether that be in Toronto, whether that be in Ontario, whether that be in northern and Indigenous and rural communities in Canada, or whether that be in some of the poorest areas of the world like Sierra Leone.